diagnosis of Alzheimer's disease is seen by most people as the kiss of death. It's a very feared diagnosis, and it really shouldn't be the case. Alzheimer's disease is a form of brain failure, and it's similar to heart failure, for example. When people hear the diagnosis of heart failure, they don't see it as a kiss of death. There's lots of things that can be done from a symptomatic point of view for people with heart failure. Likewise, with Alzheimer's disease, there's lots that can be done. There are symptomatic treatments, there is advice available, there's supports that are available. There are things that we can do to improve the quality of life and functioning of the individual. The life expectancy in Alzheimer's disease is very variable. It can be anything from 2 to 20 years. By and large, though, from the time of diagnosis to the time of death, the life expectancy is about 10 years. There are a lot of misconceptions about Alzheimer's disease, and one of them is that people with Alzheimer's disease are dangerous to society. Now, it's true to say that during the course of Alzheimer's disease, some people will develop what we call behavioral or psychological symptoms. They may develop some agitation, some sleep disturbance, they can develop depression, they can have false fixed beliefs. For example, they may believe that people are stealing their money when in fact this is not the case. And this is part of the disease process. These symptoms usually occur in the middle and late stages of the illness. Most of the time, these types of symptoms can be dealt with by reassurance, by talking to the individual, by giving advice to the carer or to the relative who's caring for the individual. In a minority of cases, people with Alzheimer's disease, because of these false fixed beliefs, for example, believing that someone is an imposter or believing that somebody is trying to steal their money, trying to harm them, can become aggressive or quite agitated. And in a situation like that, it is possible that they could pose a risk to the safety of a carer, family member, or relative. But this would be a minority of cases, and usually these types of situations can be dealt with very effectively by either a behavioral or psychological intervention or by the use of a medication.